Hi, I'm Jason Bellamy, and I'm joined by Pam Duncan. We're here. You just delivered a congressional briefing on the importance of rehabilitation research. You're one of several APTA members who are here talking to members of Congress about this issue. One of the things you talked about in discussing the value of research and the importance of it is you talked about stroke, which is your area of expertise, and how much things have changed. Can you just give me a quick synopsis of that? How significant research has been to improving the understanding of rehabilitation after stroke?
So as I started my career, the idea that you could actually recover post-stroke beyond that which would occur spontaneously was non-existent. People had a very nihilistic perspective. You had a stroke, there's not much you can do. And over the course of the last 2 decades, we've advanced science tremendously. We understand the brain is plastic. It has what we call exercise-dependent plasticity. And if we expose stroke survivors to physical therapy that is very structured, progressive, that they can improve significantly. They can not only improve their walking ability or their ability to use their hand, but they can improve their activities of daily living, and most importantly, they can improve their quality of life. So we've had the basic science, the randomized clinical trials that has gotten us to this point. Our challenge continues to be that even though we are having a mushrooming of science, we still need to figure out how best to implement it into day-to-day care of patients in their communities.
And so there's obviously this room for improvement in terms of the patient care, but you also talked about how there's room for a better investment. So the title of the briefing was related to the return on investment of this research. So the idea is that if the care improves in stroke and in so many other cases, what savings do we think there's going to be for the healthcare system, for the individual?
Well, individuals, not only stroke, but all individuals are living for a long time now. And so when we look at return on investment, if we can keep individuals physically active, independent, living in the community, your big return on investment is decreasing nursing home placements, decreasing hospital readmissions, decreasing excessive health care utilization. We now have a number of instances in physical therapy beyond stroke, but in low back pain, for example, that if we bring the skills and talents of skilled physical therapists to low back pain management, we can actually reduce the cost. It's one of the most innovative ideas identified by the Institute of Healthcare Improvement.
So as you talk with members of Congress, for example, what do you want them to make sure that they understand about the importance of this rehab research?
So we've made great advances in science and healthcare, and we improve survival, but we want to improve quality of life. And those have a tremendous value socially, but we can also control healthcare costs. The largest expenditures in healthcare are in a few individuals with major disability. And so if we can restore function, improve adaptability, and their ability to manage their health, focusing in that population can significantly reduce the economic burden of healthcare.
The briefing is one part of what's happening these several days, but as I mentioned, there are meetings happening with members and their staffs. How important is it for APTA members to get involved in things like this and get the word out to the lawmakers, to the people that can impact change?
Everything is about advocacy and networking. We as physical therapists need to move beyond our silos of physical therapy, engage with our community, engage with our area agency on aging. We need to represent our skills to healthcare providers, all healthcare providers, but most importantly to our politicians to understand the tremendous benefit. I always think the best story is told by a personal example, and here in Congress we have great examples that effective rehabilitation has changed the life of individuals like Congresswoman Giffords. So always tell the story of what it means to your mother, to your grandmother, to return to quality of life.
Absolutely. That's just one of the ways you can get involved. To learn more ways, you can go to apta.org/advocacy. Pam Duncan, thank you very much.
Thank you, Jason.
I'm Jason Bellamy. We'll catch you later.